You're listening to Nutrition Matters Podcast with Paige Smathers, registered dietitian nutritionist.
Hi everyone, it's Paige Smathers. Thanks so much for being here. Nutrition Matters Podcast explores what really matters in nutrition and health with a sensitive and realistic approach. To help support the podcast, please consider making a donation at positive-nutrition.com/podcast. If you find this episode interesting, engaging, or helpful in your life, please consider donating, sharing with friends and family, and leaving a review on iTunes, Stitcher, Google Play, whatever podcast app you use to listen to this podcast. You can leave a review about this podcast straight from your podcast app. Search Nutrition Matters Podcast, click reviews, and then write a review. You can also find me on Instagram and Facebook if you'd like to have a little more food for thought. Thank you for listening. Hi everyone, thanks so much for joining me for another episode of Nutrition Matters Podcast. My name is Paige Smathers and I'm your host, and I'm so excited to share this conversation about learning to be a little bit more comfortable with feeling uncomfortable. Today I am sharing a conversation that I had with Dr. Judy Lee Webb, who is a licensed psychologist in the Atlanta area. She's the co-owner and co-director of a group practice called New Directions Counseling Center, and she's been in practice for about 15 or 16 years, working with individuals, couples, group, and family therapy for depression, eating disorders, and anxiety, bipolar, body image, things along these lines. And so she shares her personal story of why she got into the work of doing eating disorders. And it's actually a really interesting kind of different approach and different reasons why she got into it than a lot of maybe previous guests that I've had. So you're going to definitely want to listen to this episode. She shares so much insight and wisdom in the therapy process, all the way from choosing a therapist to engaging in therapy, all of the things that can bring up all of these uncomfortable emotions, or even sometimes negative emotions, we might call them. And she talks about kind of how we can work through them, what are some practical skills we can use, and what are some things that we can actually do to be able to learn to be a little bit more comfortable with feeling uncomfortable. I think this is such a relevant conversation when we're talking about, life in general. There's so many things that feel uncomfortable about the things that we have to do in life, but especially relevant to conversations about seeking help for struggling with eating disorders or disordered eating or chronic dieting, things like that. I think that this is a really valuable conversation about how to learn how to be a little bit more comfortable with some of those things that bring up discomfort in our lives. Couple quick announcements. I always want to make sure that everyone listening knows that if you'd like to continue the conversation a little bit more, we do have a group for the podcast on Facebook. It's called Nutrition Matters Podcast Community, and I pop in there, fairly often and give you little thoughts, and people post comments and discussion, and we talk about things there. And it's a supportive, great community we have that we're trying to build up and trying to kind of support you in your process. Anyone who's willing to donate to the efforts of the podcast, whether that's financially or even if it's just leaving a review or taking a little bit of time to share it with someone, all of that stuff really helps to support the efforts in continuing to reach people, and also in continuing to help me financially and or emotionally to continue doing all this work. Sometimes people ask me if I'm getting rich off the podcast. The answer is no. I think over the 3 or so years I've been doing this, I might have made maybe $200, maybe $300. So definitely not doing this for money, more so to kind of put something into the world that I think is positive and helpful and meaningful for people. And I'm just so happy if it touches anyone's life. So thanks to all of you who support me with little notes or reviews. Thank you to all of my guests, past and present and future, who make this possible and who give me their time and their expertise. All of you are so appreciated in this process, and I'm just grateful for the work that I get to do, including the podcast. So with that, let's get into talking with Dr. Judy Lee all about learning how to be a little bit more comfortable with feeling uncomfortable. Dr. Judy Lee Webb. Welcome to Nutrition Matters podcast, and thanks so much for taking the time to talk with me today.
Oh, I really appreciate you having me. Thank you.
So let's talk about what you do broadly, really quickly. Just kind of introduce yourself to my audience, and then we'll get into the topic that we have planned today.
Okay, so I'm Dr. Judy Lee Webb. Webb is my last name, and I'm a licensed psychologist in the Atlanta, Georgia area, and I'm also a certified eating disorder specialist and supervisor. And I co-own a private practice in the Atlanta area. We have 2 locations, and there are 13 of us within the practice, including a registered dietitian as well, like you, Paige. So
great.
love working directly with dietitians. So, and that's a bit about me.
Great. And what got you interested in this work? I always like to ask people that.
In the field of eating disorders?
Yeah.
Yeah, it's a very interesting story in that I was born and raised in Kingston, Jamaica. So I did not know anything about eating disorders at all. Even when I migrated to the U.S., went to University of Florida undergrad, psychology major, nothing about eating disorders, didn't know anyone who with an eating disorder at that time. But now reflecting back, I can think back of, some folks, especially living in the dorms.
Oh, right. Like it's so normalized that you don't even notice it. And then in retrospect,
didn't notice. Exactly. And then went off to Howard University for my master's, which is a predominantly Black university in the DC area. Again, master's in counseling psych, never touched the subject of eating disorders at all.
No way. That's so bizarre.
Yeah, not at all. And I did my thesis on HIV/AIDS because that was the early 90s. The AIDS epidemic was really, rearing its ugly head at that time. So thought I'd go on to my PhD and continue studying more like health psychology. But when I started working in the counseling center, my PhD was at University of Georgia. And in the counseling center, some students coming in with eating disorder symptoms. And I was clueless, absolutely clueless. I'm like, what is this? Unfortunately, none of the professors in my program at that time, really treated eating disorders as well. It was not, still never covered in we covered in our DSM class, of course, but, not as a treatment issue.
Okay.
So I decided to change my dissertation topic from health-related issues to eating disorders, but then I had to find a professor or an advisor who would support that, So I did find one outside of the program, not within my counseling psych program. And I started researching because I just was confused, knew nothing. So as I started my dissertation it was really eating disorders and body image behaviors. It was a cross-cultural comparison. I wanted to compare different cultures.
Oh, interesting.
And then started, seeing more and more in the counseling center. I decided to do my internship at the Medical College of Georgia and the VA. And the Medical College of Georgia has an inpatient and outpatient eating disorders program. So that's really when I got my both feet in, really working directly in an eating disorders program. And I just thought it was, again, interesting. Again, at that time, not personally knowing anyone. Besides.
So no personal connection really, just like from an intellectual perspective. Oh, this is interesting.
Yeah.
Okay.
Yeah. So, finished that residency training program, graduated, and did a postdoctoral program at the Atlanta Center for Eating Disorders. So, which is an outpatient IOP and PHP program here in Atlanta. And then after that, private practice. So I was fascinated. I was like, what is this? This is something so new to me. I don't understand. I want to understand. This is crazy that this is killing people,
Yeah.
And, reflecting back, and I can think, that seems like something that was going on with so-and-so back in college or so-and-so,
Mm-hmm.
And so that's how I got into the field.
So when did you start your private practice?
In 2003,
Okay.
I became licensed as a psychologist in Atlanta, in Georgia, and joined a group practice at that time. But then in 2007, a friend of mine from graduate school, she and I started this other group practice, New Directions Counseling Center.
Okay.
So
so it's been you've been in practice for a long time, given all the schooling and
Yeah.
yeah.
So technically licensed and practicing as a psychologist since 2003.
Okay. So
Mm-hmm.
tell me about how things have evolved and some of the things you've learned throughout the years, and then we'll dive into our topic.
Mm-hmm.
I think it's fascinating to talk about, your story, how you had no personal connection to eating disorders, but you just found it fascinating. I'm assuming things through practice and through learning and more research and all the things that have happened over the past 15 years for you. I'm interested to hear how things have evolved and shifted.
Well, certainly, I'm a Black female, and again from the Caribbean, so that was unique in itself. Um, but then when moved here to Atlanta, again, at the time myself and there's another psychologist at Emory who's Black, and I felt like, well, again, you learn this is a middle to upper middle class white young female disease, right? That's what I was thinking
Yeah,
back
that's
in the
definitely the stereotype.
thinking back in the late 90s, early 2000s. But it has evolved to where this is happening in my family, in my community, in people, friends. And so we're talking about hitting multiple, different races, genders, it hits everyone. So that's how it's evolved, because the people that I was seeing in the counseling center and at the Medical College of Georgia, all white females. Okay, white females. Then when I got to the Atlanta Center for Eating Disorders, Spelman College is a predominantly Black university here in Atlanta. I started doing workshops or some presentations at Spelman at the time. This was again 2002 to 2005-ish. And I started getting some clients from a predominantly Black university. So I was like, see, it just needed somebody to talk about it.
That was my question. Do you think it was happening, but the stereotype was thin, upper to middle class female and white? Like, do you
Yes,
think that
exactly.
kind
It
of
was
stopped
definitely
people from
happening.
seeking help?
The people who came to see me definitely fit criteria for an eating disorder, you know, and they'd had it for years. It's not like just because I made the presentation, the next day they started an eating disorder.
Yeah,
They
definitely.
had these symptoms for a while. So they just needed somebody who looked like them to talk about it,
Yeah.
you know?
Wow, that's so powerful. That's such a big
Yeah.
deal.
Yeah. So since then, I've been, I've got the Hispanic, other folks from the Caribbean, Indian, so that's how it has changed. Because I myself, thinking back on the people that I knew from maybe undergrad or high school or whatever, again, they're all white. They're all white females. Didn't see any males, didn't see any people of other ethnicities. And that's not the story now. Not at all. Not at all. And that's why I went to the last IDEP symposium, which is the International Association of Eating Disorder Professionals, their last annual meeting, which was in Orlando in March. I was so pleased to attend two different workshops that dealt with women of color with eating disorders. One was led by a Latina female, and she spoke about that, and people of color, and then another that was led by three African American women talking about eating disorders in the African American community. And thank goodness, it just needs to be talked about more. And also with men or boys, transgendered, sexuality, what have you, it just needs to be talked about more.
Absolutely. I'm so glad you mentioned all that. And that's really such an important point, that it was only kind of seemed okay, quote unquote, for people who were at your presentation to finally talk about something they've been struggling with for so long, because it felt safe. They felt understood. They felt like they could finally open up about that. And
Mm-hmm.
the more representation from all the different, things that you were talking about, gender, sexuality, race, ethnicity, the more people and providers we have, or people just talking about that, the more help we're able to give. So I was looking through your website for your practice, and I was kind of reading your bios and getting to know you and some of the other folks who work with you. And one of the things that stood out to me as I was learning about you was this little statement you made, this little phrase where you were talking about how therapy can make you feel uncomfortable, and how, I don't remember exactly how you worded it, but that, being uncomfortable isn't necessarily a bad thing. And I thought, ooh, that could be something that would be really fun and hopefully meaningful to talk about with you, because therapy, working with a dietitian, working through a struggle with food or an eating disorder, all of that can be extremely uncomfortable. So I'm interested to know, what are some of your kind of broad thoughts about this idea of feeling uncomfortable? And then let's walk through maybe the process of therapy and talk about each of the different places where things can feel uncomfortable and maybe some ways to work through it.
Hmm. Yeah, so it just seems to be a pattern of when people come in and talk about their resistance to therapy, or why it took so long for them to come in, or the unknown, fear of the unknown type of thing. And so sometimes I have to go through just educating them on what therapy looks like and feels like. And even in our consent form, we have a paragraph about the discomfort of therapy. And the reality is that it does take a while for the therapist and the client to, maybe build a rapport. That's the goal, to build a good rapport, but also to get the story and the treatment plan. It's not just a one size fits all. So we say it in our paperwork, our intake paperwork. It just bear with the fact that it may be uncomfortable because you're getting to know somebody new. You're having to be transparent and reveal very personal thoughts or issues that have gone on in your life. But the goal is to create a safe, non-judgmental setting. And that you have to go through the uncomfortable pain of maybe, remembering trauma, or talking about something, that's uncomfortable, like a breakup or parents' divorce or job loss or what have you. But you have to get through that discomfort to get to the joy and get to the relief, you know.
Yeah,
And I give you the tools to get there.
perfect. So, the discomfort or feeling uncomfortable about the therapy process, it really starts before you're even in there filling out the intake form. It's even just the thought of, how do I find a therapist? How do I even get my head around the fact that I'm going to be talking about these things? Do I even want to go there? I know I might cry. I know I might feel sad. I know I might go through lots of uncomfortable emotions or things I associate with being uncomfortable. So what is your advice about some of those first steps?
Yeah, I mean, that's why even when we train our front office staff, who are the front line, they're the ones answering the phone, right? We train them to really know that the person who's on the other end of the phone call may have taken years to make that phone call, to dial those 10 digits. And they have to have a lot of compassion, a lot of patience. It's not just a quick phone call where you're rushing them off the phone necessarily, or not listening.
Yeah, that's
So
such a good
it's,
point. It really could
yes.
be a years long gear up.
Oh yeah. Oftentimes it is, oftentimes it's really about that first point of contact, whether some people email, some people call, but you have to really respond and be a, be a good listener, be patient, and not just kind of rush through a form, because they're filling out a form, patient's name, age, blah blah blah, presenting problem. It's not just a matter of just rushing through a form. And the same thing with the intake session. So have patience, and your goal is to create a open, warm environment. So, because most people take years, especially folks. I mean, because there's a huge stigma around mental health.
Yeah, let's talk
So,
about that. Yeah, what makes it so that it could take years? And what do you see as some of the stigma about mental health that we can talk about and maybe dispel some myths?
well, I know, particular in the Black community, that religion plays a huge role in in many households. And so you were supposed to go to the church or pray, to address mental health issues. You're not supposed to also go and tell your business to other people, or the family business or what have you. And so there is this sense of I'm shaming the family.
Yeah.
If I go and tell, even if if it's their own personal business, like their own personal depression, but there's this shame about that, and maybe using spirituality as your way to address it.
Yeah, and
But
almost like I'm not being a good enough disciple or follower or religious person if I'm struggling. There can be so much shame about struggling because that could mean you didn't pray hard enough or you didn't try hard enough.
exactly,
Yeah.
exactly. And so, the shame with, I mean, again, hopefully, I hate that there has to be tragedies such as, this week we've had two losses of suicide, with Kate Spade and Anthony Bourdain, today hearing about that. But the dialogue needs to continue to happen, and so hopefully as more people talk about things, because think about back in the day, I don't know how old you are, Paige, you might be too young, but but back in the day, if somebody was pregnant outside of marriage, like especially a young person, you don't, you say she's pregnant. You whisper it, did you know she's pregnant? Now or earlier, especially young schoolgirls were sent off to a group home for
Yeah,
pregnant girls.
right.
And so you didn't talk about it. There's shame and you hide it. And that's how I think it has been for mental health. But the more people talk about it nowadays, high school students or what have you can go to school pregnant, you know? Um, so, there has to be the dialogue around it, and to diminish this shame, and to replace the shame with courage, replace the shame with, just like you would for physical health, again, kind of like that mental health parity with law. We got to treat mental health the same that we treat physical health. If you're feeling a pain in your abdomen, you'll go to the doctor. It might
Right.
be your appendix that's about to burst. You might need to get your appendix taken out, like I did 2 years ago. Thank goodness I went to the emergency room, when I
Right. That
felt
could have
that.
been really bad.
Exactly. Exactly. And if you're feeling emotional pain, you go to the doctor or you go to the therapist or what have you. It's this, we got to treat the stuff that's above the neck, the brain and our emotions, the same that we treat our physical health. So,
That's so true.
yeah,
And it
yeah,
seems like culturally there's maybe certain circles that are more welcoming or that's more normal, and then there's certain circles where that's just so much. I mean, I think mental health is a stigma carrying thing in any circle, but it seems like it's a little bit worse in certain ones. Would you say?
certainly. Yes, certainly. And so, um, that's why I'm glad, hopefully there'll be more representation of other cultures in the mental health field. I know some people, and I understand you want to go to somebody who seems more similar to you. It's like, I'm not Korean. I don't speak any Asian languages or what have you. And I can understand that it might be hard for somebody, say, a Korean to come and see me. I can certainly understand that. I have several clients who want to see somebody who is Caribbean or Black or what have you, and that's why they're coming to see me. So hopefully, it's sort of like getting more people of different ethnicities and races, and in the mental health field. I'm glad to see, again, back in the day, the psychology field was predominantly male.
Yeah, yeah,
Now it's switched over, so that's a good thing, some more women. Because back in the day, women would go to check themselves into an inpatient hospital just to kind of get a break. But
wow,
now
yeah,
you can actually do some talk therapy.
for
So
sure.
it's a lot of, I like you said before, I should be stronger than this. I shouldn't have to need a therapist to address this, or I should be able to pray about it, or maybe ignoring it. It will go away. Time heals all wounds, or things like that. And I wish folks would understand that therapy to me is just like physical therapy, or going to maybe say a chiropractor. Like I just signed up for 4 sessions with a chiropractor. I was having some pretty severe lower back pain, which I've had for years, and it comes and goes. And I tell you, after that first session, felt, I would say, 60% better. I did the homework that he gave me to do, the exercise, things that he told me to do, and positions like to sleep and where to put the pillow and everything. Went back again last Friday. He did more work. Feel a lot better. I'm going again later today, this Friday. You know, because I'm following up and he's doing his job. I'm not a chiropractor. I can't do what he's doing. And he's doing his work. He's giving me my homework to do outside of the treatment. And my back is significantly improving. And that's the same way I feel with physical therapy, mental health therapy. And I hope that people look at it that way. As you come into therapy, you tell what's going on. And in my case, I really try to give the skills, the tools, so that they can work on things outside of therapy and improve.
Yeah, for sure. So thanks for the discussion about kind of the anticipation of therapy. I think that we highlighted some different barriers that people can go through or struggle with or think about, or maybe it can turn them away where they're just like, okay, this is too hard. But I think it's just I just want to highlight really quickly that you're not weak if you're struggling. You're not a bad person if you're depressed. You're not a bad husband or wife or family member if you're feeling anxious. This is all stuff that I really think the world would be a better place if we didn't have so much stigma around these things.
Exactly. I mean, our emotions and our brain can only take so much. Well, first of all, some things are really outside of our control, such as genetically or even environmentally, or maybe a stressful job. Like you're not the company owner. You don't, you're not your own boss necessarily, or there's some life issues that are totally out of your control, that it's not your fault. There's some other things that we just learn different ways of coping, or our family history has taught us to function in a certain way, and maybe it wasn't the healthiest way. And it's about sort of coming to therapy to find your new script, like what really makes sense for you, um, and giving somebody permission to do that. Maybe go against the grain, do things differently, do things differently than the way your family did, do things differently than maybe you thought. Like maybe you were supposed to go to medical school, but you want to be a graphic designer, and that
Yeah,
fits you.
yeah,
Oh, that's okay. So therapy gives you permission to sort of do what's right for you, and gives you the tools to really be healthy, make healthy decisions, go against the grain of society. And in terms of eating disorders, like your body does not have to look that way for you to be a good person, for you to be attractive, for you to be loved or worthy. It
right.
doesn't have to. So therapy really opens people's mind about it's okay to decide what's right for you, even if it's going against the society grain, the family grain, what have you.
Yeah, and just a safe place to talk about that stuff.
Mm-hmm.
Because so often if you talk about it, someone's trying to fix it or can't listen, or then they interject their own stuff, which then like it just the therapy setting is so valuable to just be able to talk. And
Right.
I don't know about you, but I find a lot of my clients, just because they know that they can talk about what's going on with their food or their relationship with it, a lot of times they end up kind of discovering their own answers just because they're able to process it in a safe place.
Right. And as a psychologist, I'm not going to tell you what to do,
Yeah,
no,
exactly.
but I help sort of walk with you and guide and help you discover what is right for you. Help
Exactly.
you discover what. So it's not necessarily, well, you need to do this and you need to do that, or what. Like, even if somebody's in a horrible marriage, unless it's like domestic violence or, abuse, in any way. But, I don't say to people, well, it sounds like you just need to get a divorce. I'm not going to say that, unless, again, if somebody's being, violently, like domestic violence or something, then, I may be more forceful with what they might want to do.
Right.
But, but in general, I think sometimes people think that therapists coming to therapy, um, it's about us advice giving necessary, and so there's a flavor of that, but it's really empowering you to to make decisions in your life or change things in your life that really feels right for you.
Yeah, that's exactly how I see my role as a dietitian as it relates to how people approach food and how people feed themselves. It's not really my job to tell you exact morsels of every single thing of what to put in your mouth.
Mm-hmm.
But in like you said, there's a flavor of that. But yeah,
Mm-hmm.
I like that.
Mm-hmm.
So what about the fear of emotion? Like a lot of my clients, like, so I have tissues available, readily available for my clients during nutrition sessions, which might seem kind of weird, but talking about food can bring up a lot of feelings, and people often will say, "Oh, I'm so sorry that I'm crying," or I'm so embarrassed," or "I told myself I wouldn't cry." What would you say to those people?
I know it's interesting. Even on TV, people say, "Oh, I'm so sorry," or "I need to get it together," or what have you. And I say to those folks, you know, whether it's God or whoever, they believe in, but we were given emotions. You're supposed to allow those emotions to be expressed. You're supposed to feel those. And I like that kind of acceptance commitment therapy where you don't avoid the emotions, you lean into it, you
Yeah, I
embrace it.
love that.
Say, yes, I love that as well. It's like, no, okay, if you're feeling frustrated, let's work through that frustration and own it. But you don't necessarily have to take the frustration and then throw something at someone,
Yeah, exactly.
but it's okay to feel it. And you sort of build up that tolerance, that distress tolerance. I mean, so many of us don't tolerate distress. As soon as we feel something, again, align it to physical pain. As soon as you feel pain, you're not supposed to necessarily pop an Advil immediately. Sometimes you can see if you can tolerate the pain, or see if there's sometimes other things that can relieve the pain, like stretching your back. That's like
Yeah.
doing
Sometimes the
some
pain is trying to
exercise.
tell you something that you need to
Exactly.
do, right?
So learn how to tolerate aversive emotions, negative emotions, because they're part of us. We weren't brought into this world with only positive emotions, you know.
Right.
So yeah, so learn how to tolerate those negative emotions, and it's going to be okay. And same thing I know with anxiety and panic attacks. I mean, I understand that panic attacks really feel like you're having a heart attack, but it's not the same thing. You're not going to have a heart attack due to a panic attack. If you have a fear of flying, you feeling anxious the entire flight from here across the pond to London, you feeling so anxious isn't going to kill you. It's going to be very uncomfortable, but it's not going to do anything horrible, to you. And at the end of the day, you're going to end up in London and have a wonderful time. Then you're going to feel fear again flying back to the United States. But it's okay. Feel it. Feel it. I mean, there's some things like, breathing exercises or what have you, guided imagery. I mean, there's some things that maybe tools you could take along to sort of decrease the anxiety. But it's okay if you fly with anxiety. It's fine.
And
As a
sometimes like
passenger,
the
maybe as a pilot, but maybe
yeah,
as a passenger, it's fine.
hopefully not the pilot. Yeah.
Yeah.
Sometimes the like we're already just going to feel a certain feeling. Like let's say like we'll go with your example of flying to London. For some people you just are going to feel anxious. But what's really interesting to me, and I'd love to hear your thoughts about this, it seems like we add a lot more to it when we're feeling bad, that we're feeling anxious, or we're feeling mad, or we're feeling angry, or we're feeling embarrassed or ashamed of this. So it's like there's some that just seems to be part of life, and then there's some that we sort of add on to it because of our judgment.
Yes, we catastrophize it. We take a small thing, say this anger, and we then add a story. Like the script again gets worse, and it's huge. You feel like you can't tolerate it. So people catastrophize things. They make it worse than it needs to be. And the reality is, say, um, yes, you lost your job, and that's horrible. You don't have an income as of today. But then they catastrophize it, and then they create a whole script in their head of what could happen when there's no evidence of that. And so if you have to know that things don't have to go from 0 to 100 all the time.
Yeah.
It doesn't have to always be that way. And I think that if they take themselves all the way up to the 100 by adding to it, like you said, of course, you're now asking your body to tolerate 100% anxiety or 100% embarrassment. And your story may not even go to close to 100%. It may not even get that far.
Right. Yeah. So
Yeah.
when you're working with someone who is not very skilled in feeling uncomfortable, maybe they are numbing or avoiding, or what's yeah, maybe they're just really avoidant in feeling some of these negative emotions. What are some practical skills that maybe would be appropriate to talk about on a podcast format? Like what are some things people can do to get more comfortable with feeling uncomfortable?
Well, I have to get them to expose themselves to the discomfort. So, say somebody has social anxiety, and my homework is going to involve at some point, maybe not session number one, I'm not going to freak them out in the first
You got
session.
to build that rapport first, right?
Right. Right.
Yeah.
But it's going to include going to an event and introducing themselves to someone at some point. So it might be, again, on a hierarchy. I'm not going to make them do that session number 1, 2, or 3, maybe. And we'll start with something that's a little bit not as anxiety provoking, like maybe go to their friend's baby shower so they know some people, right? And just sit and attend the baby shower. Okay. And then maybe step number 2 would be introduce yourself to someone you don't know. Or, and then step number 3, blah, blah. And then all the way up to maybe go to an event where you don't know anyone, like a networking event, maybe or a workshop or something like that. Or running, like, or, you know, sometimes different neighborhoods or communities, we have some, I think it's national meetup.com.
Oh
Have you ever
yeah.
heard?
Uh-huh. Yeah.
Yeah. So, go on meetup.com and see if there is something going on locally that's of interest to you and go to that meeting. So we'll work our way up to that, but exposing you to what makes you uncomfortable actually helps you tolerate that discomfort, and it can sort of blow that catastrophe out the water, meaning, so what you used to think would happen, they're going to laugh at me, I'm going to sound stupid, they're not going to invite me back, or blah, blah. If I'm going to show you that if you walk through this using the skills I'm teaching you, really, they're not going to talk to you, they're not going to invite you back, they're going to really think that you're stupid, really? And then as they walk through it, I don't know, I haven't had any person come back and tell me, Dr. Judy Lee, you were absolutely wrong. I went to that event and everybody laughed at me and told me to never come back.
Yeah. Yeah. They're like, it was fine.
Yeah. And once I got there, it was fine. And the second time was, so it's facing the fear. It's exposing them to those negative emotions. And just, it's sort of like exposures that people can think of, maybe a fear of spiders. Again, I'm not going to make you hang out with a tarantula, but eventually, maybe start by looking at pictures of spiders, then maybe looking at videos of spiders, and then maybe going to the pet store where you can see the spider in the glass, cage, whatever, tank, and then maybe the pet store person holding the spider, but you're standing afar. Then you get closer to the spider, and then you touch the spider, and then eventually you are holding the spider. Again, a non-poisonous spider. So we just work, it takes weeks or months to work up to that.
Right. And so here's a couple thoughts for you. One is just my own personal experience is the first time I do something is usually the hardest because there's a lot of buildup, there's a lot of what ifs, there's a lot of unknowns. And then, like you said, the catastrophizing kind of tends to get calmed down when you do it and you're like, oh, okay. And then you do it the second time, maybe it's still a little bit hard or scary, but you have this confidence like, oh, I've done that before, I can do it again. So I think that first time seems to be one, kind of like requires a lot of momentum and a lot of strength to kind of work through that discomfort. But then I'm also hearing you say this other idea that I think is really powerful, which is there's power in actually doing things where we can talk about not being scared of spiders, but you've got to kind of take some action. And yeah, there's like degrees and steps, and you don't need to expose yourself to touching a spider day one. But I think when it comes, if we can relate this to food and struggles with eating disorders and body image concerns and things like that, it's kind of like you've gotta do, and sometimes talking helps you figure out how to do, but at some point we've got to kind of do things and take action and experience, because that's what really helps us realize things are going to be okay. I'm capable of this. I can work through that discomfort.
Exactly. That's the behavioral side of cognitive behavior therapy. Yeah, you're sort of engaging in certain behaviors, and it includes like people. People want to say, "Oh, that meditation stuff or that breathing exercises, those so stupid." A lot of it works, for many people, and it's sometimes trial and error, finding what works for you. So for me, meditation is difficult. A lot, even meditation experts say it's difficult. But guided imagery, oh my gosh, that really works for me. Or breathing exercises or progressive muscle. So it's like trying different techniques to see what fits you, you know? Like going for walks in like wooded, like nature works for me, or beach, definitely the beach works for me. Um, so you got to find behavioral things that also work for you. And so it's a bit of trial and error, but then, so those are what we teach clients to do as they're coping with approaching the spider. So it might be, what breathing exercises can you do right now? Can you do some deep breathing as you move from step 3 to step 4 of getting closer to the spider,
Right. Deal
But
with that
yes,
anxiety that comes with taking that action.
exactly. Without maybe having to take a Xanax. What can you do that's
Yeah.
more, psychologically related instead of psychiatrically related? So, because I'm not a psychiatrist, so I can't prescribe things like that. Um, and then, like you said, the exposing yourself to the distress actually builds up your tolerance. Avoiding the distress actually builds up your fear.
Oh,
So
that's so important.
talk to people who have a fear of flying, and they are now in their 80s or so, and they still have not gotten on a plane. Their fear is huge, right? Versus someone who was able to overcome that fear earlier in life, their fear of flying is now not be zero, but 20% to where they can get on a plane. They may not love it. They may grip the arm every time the plane kind of has some turbulence.
Right.
But they were, if you never get on the plane, your fear of planes is going to be still very high.
So how do you relate that to an eating disorder?
Yeah, so if you are in fear of fat, let me just call it, fear of fat or weight gain, or fear of not looking a certain way, or fear of certain foods, fear of carbs, sugar, what have you. If you avoid these things, your fear is going to be so intense. So you're asking me to help you take away your anxiety, but you're not willing to face your fear. We're going to have to work on that.
That's a really good point. Just the idea of the more you avoid, and well, and just for a minute, should we distinguish any difference between avoidance versus distraction?
Okay.
I'm just curious if there
Avoid,
is a
yeah.
distinction. Maybe not, but I'm just wondering if there is a distinction, because I'm thinking that there might be a situation where distraction in a moment of real distress is helpful as a coping skill, but complete avoidance maybe isn't. I don't know. You tell me. What do
Oh
you
yeah, no,
think?
you definitely point. No, because I do teach healthy distractions. So again, a healthy distraction for me might be listening to some reggae music, or a healthy distraction might be going for a walk, or doing deep breathing. But that's because, again, I can't prescribe Xanax. So if you're about to have a panic attack, you feel your palms are sweating, your breathing is becoming heavy. Um, if you do some deep breathing, that will bring that down, right?
Yeah.
So healthy form of distraction, because I don't want you to have a full-blown panic attack if it's not required. So those are healthy distractions. Or if you're frustrated at work and you need to take a time out and go outside and just breathe or go for a walk, that's a healthy distraction. That's going to be better than arguing with the coworkers.
Which is different than avoidance, right?
Correct. Avoidance is ignoring, denying, acting like it doesn't exist. It's a denial. No, that issue does exist. We got to face it.
Sweeping it under the rug, shoving it down, like not letting yourself feel a feeling, right? That kind of stuff
Right.
would be avoidance.
Exactly.
Which, okay, so to connect this of what you said with food, I loved it, because the more you're avoiding the thing that you're so afraid of with food, whether it's weight gain or a certain nutrient or whatever it might be, the more that fear grows and becomes bigger and bigger and bigger. Whereas when you can face it, it stays sort of manageable. Is that what I'm hearing you say?
Right. You learn how to build up an acceptance or tolerance for it. So let's stick with food and maybe body image issues. So fear of fat on your body or fat in food. Okay. So someone who's fear of gaining weight, fear of being fat, does not want fat to be on their body. They want their belly to be flat. So let's just use their belly as an example. If they learn how to tolerate fat on their body, they will also see that other areas of their lives improve. Their social life, their family, their stressors, maybe school. Like, you can go back to college now because you don't have your eating disorder with you anymore. So this fear that they built up, that their life was going to be so horrible with their fat on their body, as they learn how to appreciate and accept that they have now more fat on their body, that their body has been asking for. Their body has been begging for some of this fat, right?
Yeah, totally.
They've been deprived for so long. If they allow themselves to walk through this journey of getting more weight on their body, they will see that their life really does improve, because that catastrophizing that they were doing before, that's really irrational thoughts. Because again, think of the people who have recovered from an eating disorder. Can they honestly say to you that my recovery has actually screwed me over more? I mean, like, my life is worse now that I'm in recovery? I mean, I haven't had a client say that to me, that their life is worse, like their social life, their personal life, their professional life, their
eating
health,
disorder might try to twist it and make it sound like that, but if they're using their healthy mind and really their wise mind, I guess, I think that the conclusion is things have changed, but things are better.
So what they've done is learned how to tolerate more weight on their body and accept it. That's why I love that acceptance commitment therapy philosophy. It's like they've learned how to tolerate it and accept it. And I'm using the word tolerate because, again, the expectation, especially with eating disorder recovery, I mean, so many people, which is wonderful, learn to truly love their bodies, right? Truly. They love their new body, right? Their recovered body. And some people, I understand, may not love it, but they appreciate it. They're like, you know what? I may not love my new body, but it's working. It's working. My life is better.
That's so important, because sometimes people think of this body positivity thing as this totally impossible ideal, and it feels almost alienating and discouraging. But you're so right. There's more than one way to relate to your body. It can be tolerating, it can be accepting, it can be gratitude for, it can be appreciation of, it can be neutral, it can be just a little bit nicer, So in terms of you being a little bit nicer to it, that's what I meant by that.
Yeah. I mean, I went to this workshop and I have an eating disorder group, adolescent group, and I had them do an activity of naming their body parts in a more neutral way. Like, my eyes are brown, my lips are plump, or my cheeks are a little rosy. You know what I mean? More neutral ways.
Yeah, just descriptive instead of
or
judgment.
functional. Yeah. My fingers allow me to text, whatever. Yeah.
Which is important to your adolescence, I'm sure.
But for some clients, do you know it was so hard for them to do that? It was
Mm.
so hard for them to remain neutral because they're so used to good or bad. That was a very uncomfortable group for them that day, to try to be neutral as they describe their body.
Oh, I mean, I don't like that was so hard for them, but I like that idea of just practicing that.
Mm-hmm. Mm-hmm.
Yeah, that's so valuable.
I have to give credit to Nicole Siegfried of Castlewood.
Nicole.
Nicole
Thanks
at
for that.
Castlewood for that workshop. Yeah, that body image workshop activity.
So, what do you wish that people knew about maybe the therapeutic process of feeling uncomfortable or about eating disorders? What, like, if you could just take a few minutes to just tell people something you wish they knew, what would it be?
I wish they would know that, yes, it's uncomfortable, but they are doing it with someone who is on their side, being supportive. They've got somebody who has their back, that someone who's on their team, then someone who's not working against them, and that it's a safe place to sort of try this. And if they stumble and fall, that somebody's there to catch them. So it's not that they're going at it alone. It's not that, and there's no you have to do this by next session and things like that, necessarily. But as long as they're motivated for change and moving in the right direction, that's good. That's good. Sometimes they'll get stuck. Sometimes they'll make a few steps back. That's understandable as well. But as long as the motivation continues to be there for positive change, that's a good thing. And again, also, it does take the right fit in terms of the client and therapist, or client and dietitian or treatment team. And don't give up on that either. I mean, sometimes if I'm not the right fit for someone, I'd rather help them find the right fit. Like especially in the Atlanta area, I know lots of therapists and dietitians, and we can try to find the right treatment team for you. So don't give up. Do not give up.
And I can't think of a single person who wouldn't benefit from having a supportive, trained therapist or person on their side who they can just talk to about what's going on in life. It's such a valuable thing no matter who you are. The stigma around it is, it's real and it's out
Mhm.
there, but it doesn't necessarily need to be that way. And
Right.
I think the more we talk about it, the more we open up these dialogues and conversation, the more hopefully people feel comfortable and supported in seeking the help that they need. Just like you said, if it was a physical, broken bone, you'd go and see someone to help you with that who's trained to know what to do. Same kind of thing when it comes to our mental health. There's just a lot more stigma around it.
Right. And hopefully that is diminishing. Yeah.
Do you think it is? Are you seeing that as a trend?
Yes. I mean, like I said, I've been practicing now in Atlanta for 16 years. Just seeing who's walking through our doors, it's a different population than it was 16 years ago.
Yeah. So that's a good
So,
sign. That's a good sign
yeah.
that things are changing, don't you think? That's great.
Yes. And even things like even more dads are calling for their kids therapy. I mean, it used to be moms, right? So yeah, more dads are calling or coming to therapy. More men, more black men. I don't. I mean, couldn't tell you back in the day if I saw a black man coming to therapy.
Yeah. That's so great. I love that.
Yeah. So definitely, I think the curtain is being lowered. The stigma, but a lot more work to do, of course.
Of course.
But going in the right direction.
Oh, that's so great. That's so encouraging and life affirming to hear that. I love that. And I see the same thing, all the way in a different part of the country, just in terms of who's calling, who's showing up, who's opening up, and who's talking. It's really great.
Yeah.
So thank you so much, Dr. Judy Lee Webb, for joining me on the podcast. Can you just take a minute to tell everybody where they can find you, especially if they're local to your area, your website, your practice, all of that.
Sure. So the name of our practice is New Directions Counseling Center, and our website is newdirectionsatlanta.com. So again, that's New Directions with an S at the end, Atlanta spelt out.com. My email address is drjudy-lee at ndccatlanta.com. So that's drjudi-lee at ndccatlanta.com. And we have 2 locations, one in Smyrna, Georgia, and one in the Buckhead area of Atlanta. So
that's so great. Thank you so much for joining me on the podcast to talk about this really important topic. I'm hoping it's helpful for people to maybe give therapy a try.
Well, thank you for doing this, Paige. I mean, especially since you can reach such a broad audience. I mean, I really appreciate you even doing. I'm very technologically challenged, so I'm glad that there are folks in the community like you who love technology, I guess, and do things like this. This is wonderful. Thank you so much.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.